Lesson 4.3, Respiration and Pulse Oximetry. The purpose of respiration is to exchange oxygen, or O2, and carbon dioxide, CO2, between the atmosphere and our blood. So it's divided into two phases. Inhalation is breathing in, and exhalation is breathing out. So one complete respiration is one inhalation and one exhalation. So make sure you understand that. Now, we always want to measure the respiration without the patient's knowledge because the patient can control their respiration, and typically people will change their breathing pattern if they become aware that you're watching it. So you never want to say to the patient, okay, I'm going to check your respiration now, because the first thing they'll do is kind of go, oh, okay, and they'll hold their breath, or they become very conscious of their respirations and they might start breathing faster than normal or slower. So we always want to do this without the patient's knowledge. So the best time to do that is when you're taking their pulse. And the way this gentleman here has positioned himself is excellent. This is my favorite way to kind of position myself almost to the back of the patient so that you can watch their back and their shoulders, and you'll see it rise with inhalation and then fall a little bit with exhalation. So you watch for both of those and you count one as one respiration. And so you're going to be checking the pulse for 30 seconds as long as it's regular, 60 seconds if it's irregular, and make note of the number, and then immediately begin watching for respirations and continue timing for another additional 30 seconds. And then the patient just thinks that you're still taking their pulse. This is the best way to do that. The normal range for a healthy adult is 12 to 20 respirations per minute. So make sure you memorize that. So there are factors that affect the respiratory rate. Age. As our age increases, the respiratory rate decreases. So children breathe much more times during a minute than an adult does. Obviously, physical activity will increase our respiration rate temporarily. Emotional state as well. Fever increases respiratory rate, and there are some medications that can increase or decrease the rate of respiration. The rhythm should be even and regular. The pauses between the inhalation and exhalation should be equal. You also want to make note of the depth of respiration, so the amount of air inhaled or exhaled. So we describe that as either normal, so the depth is the same each respiration, or deep, which means that a large volume of air is being inhaled and exhaled, or shallow, in which case the patient's exchanging a small amount of air with their inhalation and exhalation. And so you're going to determine this by observing the movement of the patient's lungs. And also you can hear it too, right? If somebody's taking really deep breaths, you can usually hear them inhaling and exhaling. Some terms would be eupnea, which is normal respiration. So normal rate, 12 to 20 breaths per minute. The rhythm would be even and regular, and the depth would be normal. Dyspnea, if we go back to our med term, dys means anything unusual or difficult. So this is difficulty breathing or shortness of breath. This is normal during vigorous exercise, but would be abnormal in patients with emphysema or asthma. Tachypnea is an abnormal increase of more than 20 breaths per minute. And bradypnea is an abnormal decrease of fewer than 12 breaths per minute. Hyperpnea is an abnormal increase in rate and depth. So the patient has very deep and rapid labored breathing, which again occurs normally during exercise and can also happen during fever and pain. And then any condition where the oxygen is inadequate, so heart disease or lung disease could cause this. Hypopnea is an abnormal decrease in rate and depth. So we have hyper, which is fast, right? And hypo, which is slow. This often occurs with sleep disorders. Hyperventilation is abnormally fast and deep breathing, usually accompanies acute anxiety, such as hysteria and panic attacks. Sometimes you'll hear people say they're overbreathing, and it tends to cause dizziness and weakness. Apnea is the temporary absence of respiration, and this can occur during sleep, which is known as sleep apnea or OSA, obstructional sleep apnea. And this can be very serious if the breathing ceases for more than 4 to 6 breaths per minute, because the patient could suffer brain damage and possibly death. Orthopnea is when somebody is unable to breathe well when they're in a reclining or laying down position. A supine, which we'll learn next week, is laying down on the back. So the breathing is much easier when the person is sitting up or standing or propped up. And I see this most often in my patients with CHF or congestive heart failure. Could also be with asthma, emphysema, and pneumonia. Basically, anything where there's extra fluid around the lungs tends to push on the lungs when the patient goes back into laying down or reclined position. And you'll see them start to breathe difficultly. And then if you raise them up or prop them up, then it often improves. So pulse oximetry, SpO2, is a painless, non-invasive procedure using a computerized device that has a clip-like probe, and it measures the oxygen saturation of arterial blood. It can also measure the pulse rate in beats per minute, which is very helpful, and usually emits a beep with each pulse. You can turn that off usually on most of the oximeters. And this provides information on the amount of oxygen being delivered to the tissues. So this is what a monitor might look like. So you'll have the SpO2, which is in a percentage. This patient's is 98. The pulse strength bar graph indicator. This is really important to pay attention to on the oximeters, because if you're getting a low signal, you might want to wait and leave it on there longer, see if the machine can pick up a better signal. Ideally, you want it all the way up to the top. Here you have the pulse rate display, beats per minute, 74. They often will have low battery indicators on them and an on and off button and pulse search indicator. This will kind of flash with each pulse beat. So what is the difference between SpO2 versus SaO2? So the SpO2 is the saturation of peripheral oxygen, and this is the abbreviation we use to chart the pulse oximetry, because the pulse oximeter measures the oxygen saturation of peripheral capillaries. You could also take a arterial blood gas analysis. This is more complete, but it's invasive. So it requires drawing blood from an artery to measure the arterial blood gas. So that would give you an SaO2. That's not typically something we would be checking as a medical assistant. The O2 saturation of healthy individuals is 95% to 99%. Rarely will you actually see 100. And since our air is only 21% saturated with oxygen, that's why it's pretty rare to actually see 100% on a patient. But you might if they are hooked up to supplemental oxygen. If you throw a pulse oximeter on them when the patient has the oxygen flowing, you might see 100%. If the O2 saturation drops below 95%, this is resulting in inadequate amount of oxygen reaching the tissues, so this could be cause for concern. Sometimes people tend to just breathe kind of shallowly when they're getting their vital signs checked, and you'll see a patient drop below 95%. And sometimes I'll just ask them to take a few deep breaths, and you'll watch it just kind of pop back up there, and then it'll kind of get up to 98 where it should be. If you're getting a reading between 85 and 90%, this is definitely respiratory failure and could be resulting in tissue damage. Below 75%, you'll usually see cyanosis or bluing of the patient's lips, fingernails, skin. And then below 70% is life-threatening. So if you see any of these on your pulse oximeter, you're sure that it's working correctly, you've had the patient take a few deep breaths to see if it can come up, this is definitely something you would want to notify your provider of immediately. Hypoxemia is decreased oxygen saturation of the blood, which can lead to hypoxia. So hypoxia is reduced oxygen to the body tissues, and if that's not treated, it can result in tissue damage and death. Symptoms are headache, mental confusion, nausea, dizziness, shortness of breath, and tachycardia. Tissues most sensitive to hypoxia are the brain, heart, pulmonary vessels, and liver. So you're going to want to make sure you note the patient's color when taking their respirations. Hypoxia can result in cyanosis, which is a bluish coloration of the skin and mucous membranes. Typically, you see that first in the fingertips and nail beds and lips because that's where the blood vessels lie close to the skin. It can occur in patients with advanced emphysema, COPD, anything decreasing in the amount of oxygen, cardiac arrest. Yes, definitely. Factors affecting pulse oximetry: fingernail polish or artificial nails. Yes, especially these dark colors like blue, black, and green cause it'll basically the pulse oximeter just can't reach through it to measure the amount of oxygen in the blood. So you might have to remove the nail polish with an acetone nail polish remover. I typically don't like to have to do that to patients, so better to try and find another site, such as an earlobe or a toe, to measure the pulse ox on. Avoid areas with bruises, burns, stains, or tattoos. Dark pigmented skin and jaundice should not affect the reading. Ambient light shining on the probe, so a bright fluorescent light, direct sunlight, overhead exam light, that could result in an inaccurate reading. Patient movement is the most common cause of an inaccurate reading because it prevents the probe from picking up the pulse signal. So you're going to want to make sure you instruct the patient to remain still. If you're putting the pulse ox on their finger, which is the most common site, I like to have them rest their hand down either on their thigh or on the table or counter or somewhere where it can keep it nice and still. If patient movement cannot be eliminated, you can measure it at another site less affected by motion, such as the toe or the earlobe. Incorrect positioning of the probe. So yes, it needs to be aligned directly opposite each other if it's a clip type probe like this. This might not work with very thin or very thick fingers. So you can use pediatric sizes for thin fingers, and people with very large fingers, do your best. Poor peripheral blood flow. Yes, this can definitely cause the oximeter to have a hard time. It can't pick up the reading if the pulse is very weak. And you can try and have the patient warm up their cold fingers by rubbing their hands together, putting it, I like to put them in their armpits. Do what you can to try and get blood circulating better into those fingers so you can get an accurate pulse oximetry reading. And that concludes lesson 4.3.